So we are practicing social distancing today, and this is Matt Boutte, who is president of the TAPA, Texas. Tell me what that is.
So yeah, I'm president-elect of the Texas Academy of Physician Assistants.
Yes. And so when does your term start?
Starts July.
Yes. And I'm State Representative Michelle Beckley, and thank you guys for tuning in. We are just going to talk a little bit from the physician's assistant's point of view. The COVID-19 town hall, is that what we're calling it, coronavirus?
COVID-19, yeah,
Is that
it's
pretty
the
much
official title.
the official
yeah,
title?
The virus has a specific name to it, but COVID-19 pretty much covers it.
COVID-19 is
Yeah.
probably what the layperson can talk about.
Yeah.
So we're going to talk about a little bit about what we can do at home, and if you take questions, if you want to email the questions, that's a little easier than on Facebook Live. We're going to try to monitor Facebook Live as much as we can, but if you do send an email, we are monitoring the email. It's michelle.beckley@house.texas.gov. And I believe it's in the top of the link. If you want to send a question, go ahead and do that. And so today we brought a little bit, so we're talking about social distancing. So we are actually, this is a 6-foot table. So we are sitting the 6 feet apart, and everybody in this room is sitting the 6 feet apart. We'll probably, after this, we will be closing down our office, and we will be going only virtual, unless we have to come in for whatever reasons. But our office has been closed for the week, and both the campaign and the district office, and we have shut down our campaign, and we are just kind of monitoring, working with our counties, our hospitals, our districts, and seeing how we can do everything. So one of the things you'll notice we did not shake hands. We're trying to not touch as many things with each other as possible. So why is that important? So tell us how this is transmitted a little bit, and why not touching each other.
Sure. So our understanding of this virus and how it spreads, currently, we know for sure that it's spread by what are called droplets, and also direct contact. And so droplets come in many different forms, and so that could be from when someone sneezes, when someone coughs. There are tiny little particles that get expelled, like little droplets that get expelled, that can have loads of this virus in them. And so that if you take that in, whether it's on your face, like take your hands, touch on your face, then you can actually transmit that to yourself. Direct contact with somebody also leads to an increased risk of contracting the virus. So the distance that the CDC is recommending, 6 feet, shows that there's a significant decline in the amount of transmission that can occur when you keep that certain amount of distance from someone who does potentially have that virus.
So that droplet's basically falling to the ground and not getting on you.
That's correct.
So it has the distance to go. So
Correct.
gotta think of it as like a ball you throw.
Yeah.
Yeah. So
Yeah. I'm trying not to catch it.
Yeah. Don't catch the ball.
Yeah.
You want to drop the ball. So those of you who are bad at dodgeball or any ball games are going to do really well in this.
Yes.
Basically, don't catch the droplet.
That's right.
So we shouldn't joke about it, but we're just trying to give everybody a little bit of some guidance on why. So let's talk a little bit about, I brought some, we're not saying yes or no to any of these products. We just grabbed these. I had these in my house. So for those who don't know, I own a bird store. We pretty much are always dealing with not having disease transmission in our store. So, because we're open to the public, and then birds are pretty fragile. So if you've ever been into my store, we have Purell on the wall all the time that's been there for 40 years, and we disinfect surfaces all the time. It is also important to use different kinds of disinfectants, so I don't think we have to worry about that right now. I've got different issues. But so for me, all of this is actually second nature, just because people with animals and people in the animal industries would understand that. So your dairy farmers, your chicken, anything where you're trying to keep it biosecure, this is kind of standard. But most people on a day-to-day basis, this is not common knowledge. And I have like gallons of bleach, so I'm good. I'm good for the apocalypse, and as far as disinfecting my house, which I didn't realize, but apparently I hoard it. I wasn't even aware. So I grabbed some of the things that I, believe it or not, had at home, and I have some other ones as well, because I have some of the veterinary services because I use it in the store. But so I thought we'd grab some of them and have Matt tell us like why these are good, what could we do better, what happens if we run out, should we be paranoid, all that kind of stuff.
Sure.
So.
So the great thing about most of the stuff that's sold, in stores is that it's going to eliminate a vast majority of these different germs. So whether they're bacteria or viruses, and in our case, obviously, the coronavirus or COVID-19 is a virus. So a lot of these products are suited to help spread the infection, that if it is on a surface, because one thing we're also seeing is that the virus can stay on surfaces for a determined amount of time, and we're unclear exactly how long that is, whether that's for a few hours or even a few days that the virus can live on certain surfaces. So cleaning with certain products, and so what Representative Beckley has gotten are going to be effective as far as helping keep surfaces clean. A couple times a day, just wiping it down to make sure that there is no potential pathogens, or that's a fancy term for, germs really, can get on you or you transmit it to someone else. The thing is with the Purell is that obviously this is a brand that, we all, know. It's probably the most common hand sanitizer there is. What the CDC is recommending is that it has a certain amount of a certain type of alcohol, and then here the Purell has ethyl alcohol, 70%, and so that's adequate for eliminating also the COVID-19 virus, according to the CDC. Some of them may have isopropyl alcohol, and they're saying that's a 60% of the quantity of that should be adequate enough. But if it's sold over the counter like this, especially with Purell, you're pretty much guaranteed that it's going to be effective with that.
So what about the people you see making the homemade?
It's interesting. There's obviously not a whole lot of data behind it, so it's hard to say. Grabbing like a jug of Everclear and making your own hand sanitizer.
Or Tito's vodka, because we do want it for the local.
Yeah.
So, but we don't want to do that, right?
Exactly. Yeah.
That is not a downside to Tito's, by the way.
Yeah,
Let me just clarify that.
Exactly. Good old Texas brand.
We do like the Texas Tito's vodka.
That's right.
We have some questions along this lines.
Okay.
The question.
This is Christina, our chief of staff. You may not be able to see her. She is monitoring the computer, and then I have Huntley, our communications director, who is behind one camera, and then we're also going to do a YouTube later, maybe, if we get that all editing. But, so what do we have our question?
So, if there's no hand cleaner available, like a Purell, what are alternatives that can be used? And then, concerning soap, are there certain types of soap that are better to use than others?
Okay.
That's a great question.
That is a good question. So if there's not an alternate hand cleaner, my hope is that there will be some access to some soap. And I believe even dishwasher soap is going to be somewhat effective even just to clean hands. So if we don't have a bar of soap or the hand soap sold for like bathrooms that we use, or dishwasher soap, it'd be pretty rare to run into that circumstance. So
I think we can get soap. I don't think that the soap, I think we all have access to soap. So do we know how hard it is to kill this virus? Like once we have the soap on there, does it pretty much die? I mean,
it's a combination of the timing that you use as far as cleaning your hands and the mechanics of actually doing that. And what I can do is actually demonstrate, like if I'm washing my hands when I'm at work in order to go from one patient to the next, how that works. So we'll say that this Purell actually is soap that I'm going to use. So get on the sink, rinse my hands, and then I'll take the soap, and then I will do this, and I'm counting to 20 seconds in my head as I'm doing this. I'm getting it all over my hands. I'm going in between my fingers like this. I'm actually going on one hand on top of the other, and then the opposite there too. I'm wiping around one thumb, wiping around the other, and then continuing to do this until I know that the 20 seconds is up. And in my head, I've gotten used to it so much that I know that the 20 seconds is up. With the hand sanitizer, what you've seen I've done is pretty akin to that. It's the mechanical nature of actually distributing the soap and the cleanser all over your hands that's going to eliminate those pathogens.
All right. So that's a good one. So do you have another question?
And actually that was one of the questions was how long should it be? So you're saying minimum 20 seconds?
Definitely 20 seconds seems to be the standard that everyone's adopting.
Okay.
This is recommended by the CDC. Yeah.
Alrighty, and so all those songs I think that people have said that you can sing, go ahead and sing your songs.
Yeah, the easiest is happy birthday twice. Just sing happy birthday yourself. Yeah.
Twice.
Twice.
Okay.
Yeah.
Twice.
Yeah.
Happy birthday twice.
Yeah.
Guys.
Yeah, it's a special
Twice.
day. Yeah.
Let me give you that twice thing. Okay. You can blow out your candles twice.
That's right.
Okay. They're caked twice, I don't know, whatever you want.
You get one of those trick handles. Then.
Yeah, you got the trick handle, so
Yeah.
pretend like you have the trick handle. Okay, any other questions there that you got there, Christina, on that line?
That's all we have there at the moment.
Alrighty, so let's go to, so we have like this 409 multi-surface. It says it kills 99% of bacteria and viruses. So what, is this something that would work as well?
It should, especially given the spray plus the mechanics of wiping things down. Now, obviously, some of these products may not have been tested for this specific virus, so it's going to take maybe time for that to come out. But well, one thing we know that won't work is doing nothing.
Yeah.
No.
So in my store, so we were trying to kill viruses and molds and stuff like that. So we usually spray things down and we let them set before we wipe it off. So are there recommendations on that for if we're using a cleaner to go ahead and let it sit before we just wipe it off?
There likely are. I can't say off the top of my head if I know or not yet.
Yeah, so sometimes like in 10 minutes, 5 minutes, you have something like that. But if you do let it sit, it does tend to work. It's not gonna harm it or foul. Like it's not gonna, it's not gonna do any harm. So if you do spray things down, just when you're disinfecting, usually 5-10 minutes is a good time frame. If you can, just leave it on there.
Yes.
So that would be a spray is going to be more effective usually in this kind of situation than a wipe. But wipes are still
the wipes
handy.
Especially because with bleach is going to kill us for sure.
Bleach kills everything, guys.
It absolutely does.
It's just really corrosive. It's very corrosive, but it does kill everything.
And these are similar to wipes that we'll use at the hospital as far as like cleaning down rooms and beds in between patients, knowing things are inspected for people who, just in general, that's used in between patient care.
So if we had this in our car and we were going to go get our gas pump or we were going to go open a door, would that be something, a suggestion if people have like elderly at home? Go ahead and use a wipe on anything that you touched beforehand?
Yeah, the caveat is that to not use the bleach wipes on your hands because bleach can be toxic to skin.
Yeah.
So we had a question, do we know how long that this virus can remain alive or active on something like a door handle, like something metal or plastic?
Sure. We don't really know for sure. There's a lot of debate in the medical community right now as to how long the virus really does last on surfaces. Like I said, there's some thought that it could be just a few hours. There are other thoughts it could be several days. At the House Public Health Committee hearing, I think it was last week or the week before, the chairman of the Department of State Health Services was saying that there's potential that it could be up to 9 to 10 days. But that's kind of the far end of this. We really don't know for sure, and so we're still trying to figure that part out as well.
All right. And then we have this aerosol. This one, I bought this. We get a little OCD in here. I'm not even gonna pretend. So this is a hospital disinfectant deodorizer that I bought. I did buy it on Amazon, just FYI. So it took about 5 days to get here, and they still had it when I ordered it. But is this something that is effective? Do we?
Yes.
Yes. Okay.
Absolutely.
So these are absolutely. And so
similar is exactly
it's
what
ethanol.
we
Yeah,
have
it's
in the
got the
hospital.
ethanol. Yeah. Okay. So this is a hospital grade. So this was still available online. I don't know how that is, but let's talk about. Do we have any other questions before we move on? Are there any other topics we want to talk? I think we've addressed everything. Do we know the solution? Can we tell people how to make a bleach solution at home? So if they're going to make a bleach.
Ooh, I don't know.
Okay, there are some suggestions online, you guys, and they're probably accurate. So, so usually in my store, I make a 10% solution, which is pretty strong. You're right. Don't use it on your hands.
Definitely
you do
not.
want to use gloves, and you want to do it in a pretty ventilated area if you really are going to use bleach. But bleach is very effective at killing everything. So if you want to do your front door and wipe your doorknob down, you might do that. I mean,
Yes,
it's
absolutely.
not going to kill it. I mean, it's it could do that. Or your bathrooms and stuff like that. But bleach does kill it's a very good disinfectant.
It does, absolutely.
And it's very inexpensive for people who may be on a budget too.
Correct.
So just kind of keep that in mind. And you can use so one caveat with that, if you use a bottle that has not had other things in it because it is caustic and you can have some reactions. So use a bottle and mark it very clearly that you're using that has bleach in it, and don't mix it with other products.
Correct.
So don't take your Lysol and your bleach and mix it together, guys.
No.
No. I know, we're laughing, but people at home may not know. 'Cause,
Sure.
you know, my degree's in biomedical science, and I'm sure you've taken some chemistry classes as
Yeah,
well.
absolutely.
So just try not to mix your disinfectants, guys. It doesn't make it stronger.
Mhm.
Okay, got a question?
So we have a question about groceries,
Mhm.
about when we bring them into our home, do we need to quarantine them? Do we need to wipe them down? So for example, a plastic bag around bread, the milk plastic, do we need to wipe those down either if they've been delivered to us or if we have gone there to the store ourselves?
I would say that in general, if you are looking at trying to avoid any sort of exposure to that, it's not a bad idea maybe to wipe down some of the outer surfaces of these things. Now, these things were, depending on what you're talking about, whether it's a food item versus a non-food item. So if it's a food item that's in a, wrapper or box, then it's likely that it was, it was put together, boxed under sterile.
They do have, there are conditions that they keep them in. And I would think I know we have all these shortages and stuff, but things are not sitting on the shelves, so they're probably not being exposed as much just because they're not sitting there.
Yeah, the fruits and vegetables that are out front right there are probably not staying there for very long.
Nothing's staying
And any
there.
meat or meat or fish that's being packaged, every store I've been to with a butcher, I mean, obviously they're very careful anyway as far as like any sort of transmission.
Well, there's health requirements. For
Yeah,
all that.
exactly.
So they have to follow, there are rules for processing.
Yeah.
Food, so, anything else there, Christina? Seems like there's less.
That was the last in that vein.
Okay.
If we want to move on to another subject, we've had a question about testing and just about are there facilities within our district specifically, or do we need to go outside of our district if that happens?
So I was just on a call with what's the acronym or the letters?
THA, the Texas Hospital Association.
The Texas Hospital Association. We were just on a caucus call with that. They're trying to ramp up the testing. Right now, we are still limited testing. They're trying to get new labs up and running. So they're right now in the district. I do not know of any drive-through. Though your wife works at Parkland, do we know what they're doing? Do they have the?
I can't say for certain, of course, but I believe that like Parkland, like every other hospital in the area, they're trying to ramp up testing as much as they can, and I think there's different online dates for these for different places depending on where it is.
Yeah.
Parkland has the advantage of having public funding, so therefore they're likely going to have an infusion in a direction as far as the state being able to provide this service, or at least Dallas County be able to get that up and running. But other facilities like maybe the Baylor hospitals or Methodist Presbyterian, or they absolutely are trying to get their testing in-house up and running as soon as possible.
Yeah, so we did have a little bit, they're trying to get the tests set where they can do it like the flu, where they do one in the office and then they send it out, so it can give you they're not quite as accurate because they're not, right now we're in the 24 to 48, we're the more accurate testing. We're in the process of getting those up and running. I think the governor just said he got supplies for $15,000 in a press conference that hold me accountable to these numbers, guys. I don't have it. This press conference happened about 30 minutes before we started this. They are trying to get where they're doing 10,000, I think a day is what they want to do, but we're not there yet. They're still ramping up. I think we still need to look at self-isolation, and there are some limits on the tests as well. At this point, you are welcome to contact our office at our email, and we are keeping up to date on all of this. As soon as we know any more information, we're probably going to post it on social media. You can join if you go on our website, my campaign website, which we are sending emails through there too, because I have a different software that I use with that. If you sign up for that email at michellebeckley.com, we will get you all our updates that we are doing, emails as soon as we have them, that we're just sending out. Those are not campaign related, but we have a service that we use that for. So we are trying to keep as much information up to date. We're also going to put it on our website. The advantage of a state rep, we're trying to get all of our cities and county in a one location, because it seems to be, the different cities, different schools are all doing different things right now. So I'm gonna just go, before we get back to those questions, kind of stick with our what we were gonna do, and then, because we're gonna talk about the curve and why this curve is so important, and why it's not a hoax, and why we really need to practice the self-isolation. And as everyone in this room right now, we're all actually farther than 6 feet away from each other. So if you want to talk about that, we're going to do it on the whiteboard. Let's talk about why is it so important to cut this curve down from a physician's appointment. I think really it's for the physicians in the hospitals, so that they can catch up.
Yeah, so there's this term that's gained a lot of popularity in the last week or so, and the term is flattening the curve. And so we got to go back to geometry class. You know?
Yeah.
So I'm going to use this whiteboard right here. And so what we have here, we have this, these things that look like grass, right? And so on this portion right here, you have the number of, we'll say cases, but it sounds very impersonal, but it's a number of affected people, so a number of patients. In here, you have days. And so the further you go this way, the longer it is, and the further high up you go is the number of cases right there. Everyone see that okay? So we have this curve right here, and let's say that this represents the number of cases that happen when we don't do any sort of social distancing, canceling of events, everything, life just goes on as it always has. Because of the way that this virus is spread, we see a spike, we should see a spike in the number of cases that happen. It's something that's happened in China, we've seen it in Italy, so we're trying to learn from other countries and their response to this as well. So when people say we're trying to flatten the curve, they mean we're trying to bring this down this way. And to demonstrate that, it looks like this. The curve gets flattened. And what you see is that the peak of the curve is smaller, and that it spreads out the number of people who are affected based on the number of days as well. And so why is that really important? Well, when you have life go on as normal, people are going to congregate a lot more, and the risk of people getting the virus is much higher. And when that happens, more people are going to get sicker and have to seek medical care. And we have a finite or limited number of places and resources available to people who are truly sick and truly need to go to the hospital. So by doing these measures of canceling events, store closures, bar closures, restaurant closures, what it does is it limits the number of people who are going to get affected, and therefore allow myself and colleagues like physicians, PAs, nurse practitioners to be able to take care of people with the resources that we currently have over a longer period of time, so the system itself is not overwhelmed. And this is in response to not having a widely available test, nor having any sort of vaccine, and no treatment to this. We have to approach it in a way that's similar to what over 100 years ago, the Spanish influenza virus, when it hit, this was a similar approach that different cities took. And so that's what flattening the curve actually means. The biggest thing with this is we don't know exactly how long these measures have to be in place for, but that's up to everybody to keep high surveillance and see how the numbers do progress. And so what we don't want to happen is that we take the measures away too soon, and that this curve starts to spike up again with the number of affected people.
So on that note, so we're going to have, because we're ramping up our testing, so we're going to see a lot of spike in the number of positives here.
Absolutely.
But these people were already positive. We're just going to find out that they were positive. So I think people need to stay calm with the number. Do we have any idea of, like, with the other countries, like, you can be positive but not actually show symptoms at all?
Yeah, we're definitely seeing evidence of that, where you may actually have the virus but not show any symptoms for a few days. You may end up having mild symptoms. I mean, the most obvious thing is when someone comes in and they have a fever, they're coughing, and they're really short of breath. That's a very obvious presentation, but it's the ones who are not as obvious, who may have a slight dry cough, maybe a low-grade temperature, or really no symptoms at all. And what we're seeing is that it is possible to spread the virus even having little to no symptoms at all too.
And do we know how long? Do we know how long people are spreading?
We don't know. We're seeing that once someone does get the virus, it may take, there's a term in the medical community called the incubation period, the amount of time that the virus is in your body and starts to replicate or starts to increase its numbers before you see symptoms. And we're seeing that's about a week or so. It's the best estimate that we have right now, I believe, that you may start seeing symptoms. But people can still transmit the virus depending on how much virus they have in their system during that time period before they get sick.
All right. And are other countries, are there spikes, are all the countries seeing the same kind of spike, or are we seeing differences by how different countries handle it?
So the black spike is what we were seeing with Italy. Italy's gotten a lot of press as far as how much of lockdown that their country had to go under because they were very much behind the curve as far as trying to identify and then keep people from getting sick and the virus spreading. I don't exactly know the data as far as with South Korea. We know that the testing in South Korea was a lot more widely available, and so they were able to have a smaller and more widely distributed amount of people affected during the time period.
Yeah, so I think they were, I think you read different things and hear different things, but a lot of the testing, it's, you're positive, so you stay home.
Right.
So guys, just think you're positive and stay home.
Yeah.
That will keep our curve, whether we're tested or not, that'll keep it. And then we also have the testing available for the people who really need it right now.
Correct.
That are actually showing symptoms. And we don't overwhelm our situation. So, people, we are getting there. It is spreading. We don't know a lot of information about this virus, but I feel we are working on it. Like all our hospitals, all our doctors, our nurses, our schools, both our schools are out till April 3rd right now in our districts here. The governor's working. Everybody's working together, but there's no set plan. We have to deal with different countries deal with it, different states are different dealing with it, and then what's federal, local, and all that kind of stuff. So kind of keep that all in mind, and that's why you've got to stay home. If you can stay home, stay home.
Yeah, the medical community, I mean, obviously this is the most foremost thing on everyone's mind, and there's no one that you talk to in the medical community who's not concerned about this, who's not trying to find out all the information that they can, not trying to also share information. The medical community is a very egalitarian system. We want people to have as much information as possible in order to take care of people, and it doesn't matter what country that you're in. I mean, that crosses all borders. Yeah.
Okay, and so we've got this, and then, so let's talk, so you're a physician's assistant.
Correct.
So most of the time, like if we're going in, most people see their physician's assistants maybe before they see their doctor.
Yeah.
So explain how, like from a physician's assistant's point of view, like how is your organization, has anything changed, or are you just, are you updated? I don't know. I'm not asking this question very well, sorry.
Yeah, it's okay.
So we're a little bit off the cuff, and we're just kind of trying to get some information to people. So, we were talking yesterday, just between while we were talking about this. So nurse practitioners and physician's assistants, and can you explain a little bit about the differences and how that is, so people can kind of get an idea of what that is.
Sure. Yeah. So nurse practitioners and PAs, so NPs and PAs. So the training for both professions is different. But the utilization of both are very similar. I have nurse practitioner colleagues where I work. They are absolutely wonderful, and if we have to, say, trade a shift or work around to help each other, we do that all the time. So even though the training is very different, the way we're utilized is exactly the same. So PAs can cover what nurse practitioners do and vice versa. The slight difference is that nurse practitioners have a specialty. There are psychiatric nurse practitioners, there are women's health nurse practitioners, pediatric nurse practitioners. So they have that scope per se. PAs, we're trained in a general medical model, so we cover across all specialties. It can transition from one to the next based on experience and working with whatever physician that we work with.
Okay, so that makes sense. So they can go to school for specialties where you're more of a, maybe say like a general, people would think of like a general practice.
They have to declare a specialty, and they become certified and licensed in that. PAs, we now we may get the same similar training in that area, but every PA program is the same in how they train their PAs, and your license is not restricted based on specialty.
Okay.
Yeah.
That's good. Okay, so I have a couple questions that were submitted over the email, and I don't know if we've had any others, but we'll check in a minute. So I'm gonna go over, so Trudy had sent us an email and wanted to know, why is this virus more dangerous than the seasonal flu and other viruses? So why is this, like, why are we, I don't know, freaking out, but
Right.
I do not think we're overreacting.
Why
And if
the
we are
response?
overreacting and the curve stays flat,
Mhm.
then let's just keep the curve flat,
Yeah.
guys. Okay, so
Yeah.
let's just laugh. I would rather laugh about this in 6 months
Mhm.
and say, oh, do you remember 2020 was like, you know, your Y2K? Let's hope that would be the best solution.
Yeah.
That nothing happens and we have a flat line.
Yeah.
But so why is that probably not the case?
So the thing about this virus is that it's new, and the reason that it's new is that no humans had ever been infected with this particular virus ever before. The difference with the seasonal flu is that it's a different type of virus, but it's similar to other flu viruses we have seen before. And so because it's a very new virus, we have absolutely no protection. You, myself, or anyone in this room, or anybody had no previous protection to this virus before.
From our own immune system.
Correct,
Yeah.
for our own immune system. And then on top of that, there's no vaccine for it as well to offer protection as well too. And so because of that, our immune response is very different to this virus. Some people it may not affect really much at all. Other people it may affect pretty severely, and that's what we're seeing, and those are the people who do need care in the hospital. And so that's really one of the biggest differences, is that it's when your body's exposed to a very new virus that's never been seen before, then you cannot predict the response that it's going to have ultimately. And so that's why these measures are in place until we have adequate widespread testing and possibly vaccination in the future.
And then on the call today, they're talking about this virus is mutating and
Mhm.
evolving already.
Mhm.
So it's not even the same as it was months ago, or so we're still trying to see, like, is it going to go into nothing, or is it
Mhm.
going to become more virulent? So like,
Sure.
so we don't know where it's going yet. So
Right.
a lot of what people might think of as overreacting is just, it's the unknown,
Mhm.
and we're trying to be better to be prepared and
Mhm.
safe than sorry.
Yes.
So that's what we have going on right now. So
Mhm.
okay. So this is from Deborah, this other question. So
Okay.
did everybody, hopefully everybody got an answer to that. You can send it to, if you have any other questions, we are still monitoring, we can answer them for you. So Deborah sent us a question. So her husband's 56,
Mhm.
and he would be considered high risk because he's got heart disease and he's on blood thinners.
Mhm.
How safe is it for him to be around his 6 and 8-year-old grandchildren?
So there are certain risk factors that we look at as far as when someone may be more likely to have a severe response to the virus, and age is one of them. We do know that the older people get, the more likely they are to have a severe complication from the virus itself. The other things we look at are, the term is called immunocompromised, and that basically means your immune system, which normally fights these things off, has been, there's something about it doesn't work as well as with other people. And so that's traditionally thought as people who have diabetes, those who have kidney dysfunction, those who are on medications to help suppress the immune system, like people with lupus or rheumatoid arthritis as well. People who have had transplants before, those are people who are very high risk as well. So the issue is that if the safest thing to do is to keep distance. And the great thing about living in the day and age that we do is that we have adequate access to technology to FaceTime with your grandchildren,
Yeah.
see how they're doing.
Yeah.
And you can stay in touch with people as we couldn't do 30 years ago. These things were,
No, we're on
Yeah.
Facebook Live now.
yeah.
So right now we're live, so you are getting your answer to your questions. So we are going to we're gonna probably start doing a weekly one. We're organizing everything. We are adjusting and evolving as we speak, even our offices as well, with the virus, hopefully. I shouldn't make fun of it, but, so our recommendation, probably the recommendation is to maybe just FaceTime and stay a little distant until we know more.
Right.
Until we know more about what's going on and how
Right.
this virus is going to do it. Yeah, and we don't even, probably too, and how much, we really don't even know how much our population has been exposed at this moment, because until the testing ramps up. So at least go ahead and wait, Deborah, and Deborah, I actually know Deborah personally, so Deborah, go ahead and wait, and you can call me later and we can have a talk, but we'll have a personal talk. But yeah, so I would recommend, but Deborah's, that situation, we have a lot of people in that situation.
Absolutely,
So
yeah.
that is definitely things, and I think we are gonna do fun things that you can do with your children. Well, we can add, what can grandparents do? I'm gonna have interns that were doing other things. Now they're gonna be helping y'all with fun things to do at home, as well as these heavy talks that we're kind of having today, which is kind of the virus. But we know that we wanna help our constituents with what they're doing. And so as your state rep, we are gonna be looking into that. And the good news is I have 3 interns that we're helping on the census, which we are gonna do one next week on how to do your census, and I'm gonna do my census online, Facebook Live. So yeah, we're gonna do that, where we have ideas for all of that, but I bet we'll all get our census done online because we're home.
Yeah.
Because it all came in the mail this week, but that's another comment. Okay, so is there anything regarding that? Are there any questions regarding that, Christina, that you have? You've got sticky notes galore there.
I do. So let's say that we have a sick loved one in the home. How do we take care of them and trying to prevent the virus from being spread to both yourself and others in the home?
Yeah. So that's basically going to require some sort of protection for yourself, but also for that loved one. And I realize that our supply of like gloves and masks is pretty limited as far as what people may have access to. But if there's a way to obtain some sort of like a surgical mask for the patient who's affected, that definitely decreases the amount of spread of the virus. Doesn't make it zero, but it decreases it. And if you were to also have a surgical mask and were to wear along with gloves, and then washing your hands in between each contact, that alone goes a long way towards hopefully preventing spread of that. And then obviously doing things like, not sharing the same cups, plates, utensils, having, wipes or cleaning products in the home. And if you have access to a second bedroom or a different room in the house, to stay in separate rooms for the time being. And I realize not everyone has the ability to do that, but those measures are going to help, possibly prevent you from obtaining that while you're trying to take care of a sick loved one.
Laundry, do your laundry.
Laundry is very big too. Yeah.
I have an allergy set. Y'all have some OCD. So OCD fun thing with me is I have the washing machine with the steam and the allergen setting, which I think was the best thing in the world when those became about. And because I do have OCD with diseases, so but clean. You can use. I've read where I have gone to where I have all white sheets, and so I can bleach them. So, or you can bleach your colored ones. They're just not going to be so pretty afterwards. But you can go ahead and keep everything. It's really, the cleanliness is next to godliness.
Yeah.
Kind of got to go back to that.
Yeah, all those things your parents taught you before, like that this is the time to bring them out.
Yeah, go with all of those things.
Yeah.
And don't sing Ring Around the Posies, because we don't want to talk about that.
Yes.
My staff is like, please, Michelle, stop talking. Okay, so we're doing another.
We did have another question on there about gloves and masks in general.
We'll get to that one. So we'll go ahead and I'll go out of order then, because I don't know that there is really an order.
Yeah.
So Valerie has, some of her team are very concerned about the virus and are wondering if they should be wearing masks and gloves. And can you explain why this may not be effective for them and keep the resources for the medical professionals? So,
Yeah.
And then I've seen that online too. Not just Valerie's not the only one with this.
Yeah, what we know about with wearing masks and such is that if you don't have symptoms and you're not encountering someone who really has symptoms, then there's not much protection it necessarily offers you. Now I know that's kind of contradicts what I said earlier about there are people who have no symptoms who maybe transmit the virus. It's just unfortunately at a stage where we just don't know at the time being. But what we do know is that if you don't have symptoms, then the need for these resources is not as great as for someone who does have these symptoms, or for people who are taking care of those who are sick.
And on that note, we were on our call earlier, there are other masks and gloves that may be not medical approved, but probably like in the gas and oil industry, so they're sitting, they stockpile them there, but they actually do the same things, so they are going to be using some of those that maybe it's not firemen anymore, and I'm so firefighters. Sorry guys, I'm old, what can I say? Trying to be inclusive, fire people, but for the firefighters, but what they have, while it wasn't made in a lot of factories and stuff like that, but they're actually made the same way and they do the same thing. So they're looking into other solutions while we have this shortage of equipment for some of the medical professionals.
Correct. Yeah.
So we are looking. They are doing the state is going through and doing a allotment for all of that too. So they're looking at other sources and they're becoming inventive on other ways to help people. But we really need it. Our medical professionals need to make sure we have our supplies for them.
Yes, absolutely. Yeah.
Okay. Do you have another?
Yes. So talking about our pets, because it's believed this started off in animals, can we then pass this back on to our animals, our cats, dogs, etc.?
I can't say for certain because I'm not trained in veterinary medicine, but what we do theorize where this started was from bats. And in fact, bats actually have been the start of many different sort of what we call zoonotic or animal origin diseases. And so we don't think that there's a spread to dogs and cats. Obviously the vast majority of, and birds, I should say.
Yeah, birds. No, I actually I did have somebody emailing that. And as far as because they asked, should they do social distancing from their pets? And right now, there's no indication that that's the case, that you need to do that. And the coronavirus is a family of virus, and it's not what we are vaccinating our dogs from is not the COVID-19.
Correct.
So that coronavirus is not the same coronavirus, which is kennel cough in our dogs. So what we would normally call that, but or a form of kennel cough. But because we bore dogs too, so I know more about the pet industry. But I think that going back and forth between animals is very rare, and that's why. But when it does, we get this kind of an issue. And viruses going the other way. Humans can get viruses the other way too, but we're not usually as obviously the medical profession would be concerned about that.
Yeah, absolutely. Yeah.
So I think at this point, you don't want to say no, but there's no indication that would be an issue right now.
Yeah, we really don't know, and I apologize, I'm not really up to date necessarily on, is it transmittable to pets or not? Definitely questions for veterinarians who I'm sure are debating this as well too. And
I've reached out. I don't think there's any consensus right now. So
But continuing on with the idea of social distancing, are these lessons that we're learning right now? Can this help us in the future with the flu, with maybe another thing that comes up? Is this something that can be used more than just at this time with this virus?
Yeah, I believe that, so this is something that we have employed in the past, but none of us were alive when it happened, and that was back over 100 years ago during the Spanish flu epidemic across the world. That was the last time we really had this kind of issue where we were doing this social distancing. There's actually an article that's been distributed around with this curve that talks about different responses in different cities, in particular Philadelphia, who really didn't take a lot of preemptive measures as far as social distancing and canceling events, in St. Louis, who did, and their cases matched exactly with what this flattening the curve thing we're trying to achieve really does.
So this isn't just something we made up today.
No.
This has been proven to work. This isn't just medical professionals thought, oh, let's do this today.
Yeah.
No, there's research behind this.
Absolutely,
Okay.
yeah. Mm-hmm.
Clarifying that. Just,
Yes.
I'm just not judging you.
No.
Clarifying.
Yeah.
Well, like I might have been a little judgy.
No,
but
no.
yeah, just because okay.
However clear we can make it.
Yeah,
is
I
what
want to
we
make
do.
it clear that this is just, you know, like we're kind of saying, we'd rather laugh that we were overreacting than it to the spike. And you know, I think we are seeing different countries with different levels of spike, and then how hard it's hitting everybody.
Right, exactly.
So I mean, I think I've seen if you guys go online, there's the spikes are there because it's data is collected on what they have, the data that they have.
Right.
Yeah. Now our spike is going to get really big, guys. Just FYI, because not with cases, but the number of people who are going to test positive is going to go up because we're going to start testing more people.
Right.
So, but probably not the percentage. It's just
Yeah,
we're going to find
it's
the people.
it's maybe not necessarily the percentage of people who are sick necessarily, but yeah, once you know having the testing is widely available is extremely important so that we have a good idea as to you know what sort that we know the numbers that this virus is affecting and gives us better data as to who we do need to isolate, who we don't need to. Can we make better decisions as far as with public health, right?
And then we're gonna know like what's that death rate, like because right now there's a huge range. I've seen numbers from 1% to 6%. I think I've seen it.
Yeah.
But we don't really know even where that is right now.
Right.
And so what's the flu? Let's talk about like what's the flu and so we can give people what we're dealing. Kind of the difference here.
Yeah, the flu is it's another type of virus. So it's the biggest things is that you have fevers, body aches, maybe a little bit of a cough, but the biggest thing that people seek medical care for is that they just feel lousy, and it hits immediately. And the first 48 hours of the flu are the worst. If you ever had it before, you just feel really achy, tired, but it hits like a truck, all of a
By the
sudden.
way, I had the flu last session. It's awful, and I can say that now because first time in my life. If you think you've had the flu, you haven't had the flu.
Yeah.
Let me give you guys a heads up. If you think you've had the flu, you actually haven't had the flu.
Yeah.
So,
And the other difference is with the flu is that we do have medication to treat it. It's one of the very few viruses that we can actually treat. Now there's questionable efficacy or questionable as to how much that drug does work as far as the flu. The vast majority of people do very well without taking the medication. But that's where the difference is in how the COVID-19 virus affects you, is that it doesn't hit all of a sudden like we're seeing with the flu. It's a very gradual process where you start having this lingering cough, you have a little bit of a fever, then you may get a little short of breath, but it's a much longer progression.
I mean, you're going to shed it longer because you're going to be out and about.
Exactly.
More. Yeah.
Yep.
Where the flu, when it hits you, you're in bed, and Netflix is your friend. Actually, you probably don't even care about Netflix at that point.
Yeah, the majority of people who are in the medical field, like they know when someone comes in who has the flu. It's pretty obvious, and there's not many other things that do that.
Okay. Do you have any?
So then what are the symptoms for this?
So what we're seeing is that the vast majority is cough, some sort of fever, even a low-grade fever. And in the medical community, a fever is defined as less than 100.4 Fahrenheit, or 37 degrees Celsius if you're so inclined. But the coughing is the primary thing. The thing that what affects people the most is getting into their lungs and causing their lungs to not operate or function as well as they normally would. And that's what these people are getting when they're really sick, is because they can't breathe very well. But predominantly, or the vast majority of people, it's some sort of fever, some sort of cough for sure.
So is it like an asthma kind of cough, or is it, when people have?
So we're
The shortness of breath. Would it be
well, the shortness of breath seems to happen when the body's response is that so when the body tries to fight off some sort of infection, it dumps a lot of fluid into that area right there. It's these healing factors that try to solve the problem. And so the body can become overwhelmed and dump a whole lot of fluid into the lungs. And when you think about your lungs are a tight space, when that fluid gets into there, then your ability to breathe in and out and exchange air becomes a lot less. And so you almost have like this kind of drowning feeling. There are people who are the most severely affected by that. Those are the people who we have to actually have these machines, these ventilators, to help breathe for them in order to try to get them to recover from that.
So we actually had a question along that line. concerning our district and maybe our Metroplex area. At the moment, how prepared are our hospitals? Is this why we're trying so much to focus on social distancing and flattening the curve to help our hospitals?
Yeah, this is when, that's why this is so important, and that's why the public health measures have been taken, is that it's allowing time for hospitals to catch up with the resources that are necessary to take care of people. I'm certainly not here on behalf of any hospital or group or whatever, but you know, I know that there are some of my colleagues who are experiencing you know, shortages regarding equipment, regarding space for taking care of patients, and just, you know, and that compromises your ability to care for other people who show up to the hospital for care who aren't even sick with this virus. So that's why we happen to be so, you know, out front as far as preventative measures go. Medicine a lot of times is a very reactionary thing, and so we forget a lot about times about the preventative health side of things, and that's where this is a big part of that.
So along that, we were talking before we came in that your wife, his wife works at Parkland, so they were noticing in the ER, and she's an ER doctor, that we are seeing people not using the ER for non-essential, or we are seeing that people are following those rules.
Yeah.
We're starting to see that. So thank you everybody out there who's not just randomly going to the hospital for things that aren't, because it is letting your medical professionals maybe get a rest, because they are going to need all the rest they can before this really hits.
Yeah, and I also work in emergency medicine. Of course, I won't say where, but you know, the less, if you really need the emergency department, we're here for you for sure. But if you don't need the emergency department, then I advise, like, there are other ways to obtain care. And as we said before, the biggest thing is that if you are suspicious you have this virus and you cannot get tested, and you may feel a little bit lousy, but you're not at the point where you need dire help, then staying at home and quarantining yourself is really the best thing.
Okay, so we have Monica, or do you have?
Nope.
Okay, so Monica asked, this is kind of a complicated question. I don't know how, we'll ask it since she did submit it.
Okay.
And it's kind of long. So Monica works in an office space of about 100 people, 100 plus people. Her entire department is 20 people, and she views her work as non-essential and can be done from home. But our business is doing its best to clean the cubicles and making sure they're all clean and everything. But they have not, I guess they're not telling them they can stay home. And she, only upper management can direct that, and the directive has to come from the CEO. Is there anything she can do in this situation, because she can't quit her job to keep herself safe, so she's having to go into work?
I see.
Yeah.
So if you, so I think it kind of harkens back to what we've kind of talked about, and that is keeping spaces clean, and then taking, that's really the predominant thing, is that if you keep your workspace clean, if you buy some, disinfectant spray, these wipes, wipe down things, limit your exposure to people, keep that distance of 6 feet, right? Because I can't imagine there's a situation in business where you really truly do need to be like right up with somebody. I'm sure there is, but for the most part, business can be conducted even if it's in an office. You can do it at a distance of 6 feet for sure. Yeah. So those basic things are going to help a lot. And then, of course, if you start to develop any symptoms at all, then it's at a point where then other measures need to be taken, like say, hey, look, I do need to stay home. And then utilize the ability to telecommute.
Telecommute then, yeah. So if you start having symptoms, stay home, or any of your coworkers start having symptoms.
Yeah, I think the great thing. Yeah, I think the great thing about this is that I guess I'm hoping there's not a whole lot of resistance among businesses for allowing employees to be able to say, I'm not feeling safe with this. I really do think I need to work from home if they have the ability to. There's certainly a lot of the way that society is moved right now is very much in the preventative phase of allowing people to work from home if possible.
Yeah, and I've seen, I've got notifications, some businesses are closing, they're reducing their hours, they're cleaning their surfaces. So I know, I'm in the pet industry, so we have to come in and take care of the animals every day. So we can cut back our hours, we can cut back our employees, but that also kind of limits from a small business stance. We're trying to work on that too, so that may be a different, Facebook Live that we do later. But just everybody, it's the washing of the hands, it's the Purell, it's the keeping the surfaces clean, and then if you have any symptoms, go ahead and stay home.
Yeah.
But you've got your food delivery people who are still working.
Yeah.
Thank you.
Yes.
I would like to shout out to all your food delivery people because I've sure been using them. I see our restaurants are going to curbside. That's great. Especially guys, we want to help our small businesses. You're not prepared to do all the work.
Yeah.
If you can, take advantage of those. Some of the meal prep things, they're out there still too. Though I have just, I have a grocery delivery and they have not been able to deliver since Sunday because they're completely out of stock. So we did have to go to the store because I was trying to avoid a little bit, and then I've been super busy. Super busy. You guys, we've been on conference calls since Sunday, just trying to get organized and trying to get everything together for everybody. Okay. Yeah. Any other questions? Yeah.
Just on a pet focus for just 1 second, that because of everything going on, people might not be able to feed their pets. So are there any food assistance programs that you know about for pets along with people?
Oh, you mean somebody can come home and take care of your animal or
no,
something?
No, I'm sorry,
yeah. Food. So there are delivery options on that. Look at a lot of the local stores probably are doing like other businesses. I do know there's delivery that you can get your pet food delivered. You can buy it in big bags, guys, that'll last the probably 2 months. And the reality is we're looking at 2 months minimum right now, and that's what everybody's talking about. We've got to hit our peak. We got to hit our peak and then start coming down from it, and it's going to be a longer time than what people. Y'all, it's July or August. Let's just be fake. I'm gonna be frank with you. We're gonna unless something totally goes not what we think, but everybody's talking July and August. We're gonna hit that peak and then we're gonna come down from it. Maybe not, but I don't want to freak everybody out. But we're gonna adjust with this.
Certainly, once we have more widely available testing, and that's improving day by day. Every day is getting
Once
better.
we get the testing, we're gonna know where we are.
Absolutely.
Yeah, and that's going to tell us more information than not having it. And all indications, the testing's ramping up. That should be in the next couple weeks. That testing will be ramped up. It's just going to take the time to get it ramped up.
Yeah.
Yes.
So one last question: for those who are uninsured, do we know of what they can do if they believe that they're ill?
So there's always if you believe that you are ill, then that's really what the emergency department is for. If you feel there's something that needs to be addressed, the emergency department is there no matter, insured, uninsured, whatever. That's what we're here to do, is to take care of everybody when they need us. If it's not something that you believe requires the emergency department, and that's going to be a very difficult decision because it's very individualized as to that. Then I know that there are low-cost clinics. If you have access to the internet, then being able to search that out can be helpful too. And I'm sure that there are clinics that are extending services for evaluation, and once testing becomes available, I think that's been a very something that's been, we're trying to, I think, make testing a public service per se, that it is free, so that we get a better idea of what's going on, so that people do know as well too. And so the caveat always is that if you think that there is something, urgent or life-threatening, then you absolutely should seek, care of the emergency department no matter what.
And I'm sure we can address that with some other resources that we have available too. That actually hasn't come up as of yet, mainly because we're trying to get the curve flattened. But I'm pretty sure our governor and people are going to look into that. With our high uninsured rate, the reality is there are going to be uninsured people getting this disease and going
Yeah.
to the hospital.
Absolutely.
There's no way.
Absolutely.
There's no way in Texas that that's not gonna be an issue. So, but you still need, we gotta get that curve down, so we need you tested, we need, if you think you have the disease, you need to go seek the medical help that you need.
Yeah.
So like, we're just talking, one more question, do you have any other questions, Christina?
Yes, just a clarification about the pet question with the food. I apologize,
No,
I
it's
didn't
okay.
phrase it correctly. It was that a lot of people, not a lot, there are a number of people who are abandoning their pets right now because they feel like they can't take care of them, etc. Is there any, if you can't afford pet food, do we know of assistance programs to help, do that?
I do not know, but we can research that, if you can get that
Okay.
person.
I will do that.
If you could send an official email to our state email address, which is at the top of the, if y'all are on Facebook Live, the link there, if you don't have it, but it's michelle.beckley@house.texas.gov. I actually am gonna know my email address by the time I'm done with this. No, y'all, it's just our official, it's a different one. But if you send an email there, I will research and see what I can do, because I could probably, I don't know right now. So my store, I have a wonderful manager in my store who's been taking care of my store, thank goodness, so that I can be on all these calls and do all of the stuff that comes in with being a state rep. But I do have access to the pet industry, and I can find out if there are things. I think there are probably some places I can, nonprofits and stuff that help you with, but I will look into that and get that information out there too.
And then one last thing, we've had some specific questions, which I don't think we can answer here, about the number of tests that we have, etc., but maybe directing people to Denton County Public Health.
Yeah, so, a lot of this is still under the counties. So the counties are, and the public health situation is going under there, as they're ramping up. So they're just not, the testing isn't ramped up yet. And they're saying by the end of this week, but it may be, we'll see. I mean, it's ramping up every day. More tests are happening every day, which is why we're seeing more numbers of people testing positive. So, we're gonna see that. That is definitely happening. I do not know what the numbers are of Denton County or this district. We can reach out to our hospitals too to see what they're up to. But we did reach out to our hospitals, and so far they have not come back with any specifics. So I'm gonna take that as a good sign right now, that the hospitals, we did reach out, say, hey, if there's anything specific that we can maybe find some solutions to. They haven't come back, so I'm sure they have networks of their own, but we are open for them as well.
Yeah.
So we'll keep ramping up. I mean, the thing is we do need to ramp up the testing. The testing, we have seen South Korea's with their testing. I mean, they were testing how many? They were testing a lot.
I mean, they were testing early and often, and it did make a difference as far as making smart decisions about what they need to do for their citizens.
Well, and then they could also find, like, if this region, there's a lot of positives, then they know that where they could send people and stuff like that. So, but I think that right now everybody is working toward that. There is no indication that that is not happening.
Right.
So I think that everybody's ramping up. Private labs are coming on, and they're, that's the reality of the American Medical Association. So the private labs are ramping up, but there's, they have to meet some criteria. It's not just that they can snap their fingers and do the testing.
Yeah, we want to do testing that's reliable and accurate. We don't want to, have testing or people get tested and they end up getting false positives or false negatives, and then we can't make proper decisions for people's healthcare. Yeah.
So one of the things we saw with that, which we talked about today, is it was preemptive testing, but now they've gotten away with that, because what was happening is the CDC was looking at the test again to make sure that they were correctly done. So they've taken that out. They realized that the labs are doing those tests correctly. So we're going to see. So that's already changed. That has already gone into effect. So that's holding off, I think, 24 hours or 48 hours worth of time. So we're going to see that that's changed now already. So.
Yeah.
Okay. Anything else there, Christina? Nope. Thank you. Any other questions? I think we got anything. Is there anything that you would like to let people know?
Yeah, I just want to say that I realize this is a very uncertain time that we're in, and believe me, those of us in the medical community feel it as well too. But I assure you that any one of us who are currently practicing in today's climate, our number one goal is making sure that we understand this virus, we understand how it affects people, and we keep as many people safe as possible. Because at the end of the day, we don't want anyone to, we don't want this to get worse. We're doing everything we can to help take care of people, identify it, and keep all of us safe.
Thank you guys.
Yeah.
Thank you, and I think we will keep you updated and see you later. Thank you. Bye.
Yeah.